Hi everyone again. So from my last video that I uploaded yesterday, from my day one to post 2 months post surgery, I've had a couple of messages of people asking about care, like the care after surgery. So what do you need to do? How do you need to look after your scars? And I wanted to kind of go through all of the bits and pieces that you get through, or that you get at the pharmacy and that you get afterwards as well. The antibiotics that I had, I don't have here. And I'm looking here because they're all kind of like spread out. But I don't have the package for my antibiotics, but I do have the package for the pain relief that you get. So I wanted to kind of show you the things that you should expect to have when you are discharged from the hospital. Once you have your drains removed, once you have your cannula removed, what happens when you get to the pharmacy, and then what do you need to keep doing afterwards. Also, after surgery, Nida will share with you like a post-op care guide that'll tell you like the timings of when you can stop doing this and when you can start doing that. But I know that people were just asking about like the care side of things and what I have been doing to keep on top of that, and how my scars have healed or are healing as good as they are. So the first thing, kind of what I wanted to show you, was the bits and pieces that you need. So once you go to the pharmacy, you will need to get some of these bad boys, and they are, you can see, they're like they're five centimeters by 10 centimeters, and they're dressings. And these will be used on your nipples. So once you have your nipple dressings taken off on chest reveal day, this is what goes onto your nipples along with this little bad boy. And this is the stuff that you get in Turkey. I think you can actually see that it's in Turkish language. Yeah, you can see there. So this is one that you get in Turkey, and this is the sterile antibiotic cream that goes onto your nipples. And what you do is you put like the tiniest blob onto your nipples, and then you would put one of these over it. What I should have done before I went to Turkey is I should have bought some on Amazon. I got this box off Amazon, and there was 50 in there for about a tenner. Don't go to the pharmacies in England and buy them because they are ridiculously expensive for like five. Whereas if you can go on Amazon and buy a box of these, I still have like loads left. And you can get them for like £10, but they're 5 by 10 centimeters that you need. I'm actually just going to take one out of the packet so you can see it, because that just seems to be the easiest way to do it. And they look a bit like this, and they've got like sticky bits on the back, and then you just peel it off and you put it on to your nipple, along with this. These two go together. And I think you do that for about 10 days. Please don't quote me on that. Like I say, Nida will send out a guide to you, so then you can make sure that you're doing it to the right time scale. And then once you do that, you are given some scar gel, and it comes in like a little tube like this, which you can also get from the pharmacy in Turkey. But it lasted me maybe 2 or 3 days. It didn't last me very long. So when I was back in the UK, I got this bad boy, and this has done me for about a month, putting it on every morning and putting it on every night. And this will go on after your scar tape comes off. Now the scar tape is a bit like this tape that sits under your lines. So if I just going to get my chest out because I think it's easier to show. So as you can see, like here, the tape will follow that line there, and that will sit there for you. Now, in the guide, it says for you to use the silicone tape, but I had a bit of a reaction to the tape because I have quite sensitive skin. I've got eczema and I kind of have allergies. So I just got the silicone scar gel. And all I've been doing in the morning and in the evening is just massaging it into the scars. So putting like a little tiny bit on your finger. So if you do it now, like a little tiny bit, and you just stretch out and just give it a little massage in. You will start to do this obviously once the scar tape comes off. In the video that I posted yesterday, there is a picture of me with the scar tape on, and there is also a picture of me in the sea with the silicone tape on. And you need to make sure that if you're going away or if you're going to be having your top off and in the sun, make sure that you put something on it. Put sun cream on your scars and also put it with this. I will put this this tape on if I am like going sunbathing or if I'm doing something to protect the scars. But when you start to do this, you'll feel there is a massive build up. If you have double incision, you'll find that there is a massive buildup of scar tissue. So when you're massaging it, it's about breaking that down. When you start to do this, you might need somebody to help you because reaching around this way like that is quite uncomfortable, or reaching across is quite uncomfortable to start with. But as you can see, like my incisions go quite far back. And if I put my arm down, there is still a lot of swelling. So swelling is normal and it's okay. But it's about over the next, like once you are able to get to about 6 weeks and start doing some physical exercise. I've been swimming and walking and doing bits and pieces like that, and it will start to help with drainage on your chest. Also, when you start to massage the scar tissue, it may swell and it may feel like it's bruised. Don't worry about it. It's just where you've been breaking down that scar tissue. You can see here where my scars have puckered a little bit. And that again is just like where the swelling is. But when I feel my chest, like especially on this side's like less swollen than this side. But if you start to feel like your chest, again, thinking about like post-op 6 or 7 weeks, you start to feel like your pectoral muscles are starting to come back. But like with the nipples will get their color back once the nerves have all reconnected, and the stitches, like most of my stitches have fallen out now. They will just naturally come out. But the first bit is about making sure that you're looking after your nipples. I'll share a picture if I've got one, of what my nipples look like when I was using this and using that. It goes like almost like scabby like. I panicked a little bit because I thought, oh my God, are they infected? But it's not. If when you change them, so you'll do that twice a day. So you'll do it in the morning and you'll do it in the evening. Like before, like for instance, like you have a shower in the morning, change them. If you're going to have a shower in the evening, change them. If there is like any excess, like cream on the nipples, just use some of your dressing just to literally wipe it. Don't like rub it. Like literally wipe it off like that, put that in the bin, and then put a new one on, because it does go like quite scabby like. Once you have used this, once you've done your time doing this and doing that, sorry, I mentioned it was twice a day. It's not, it's once a day. Once you've finished doing this, then you go over to this, which you can also get in Turkey. And this is still something that I'm doing now. It's about moisturizing the nipples. So it's literally like a tiny little bit on the end of your finger and just a gentle massage into your nipples. I have no sensation in my nipples at all. Like I can't really feel what I'm doing unless I like press down. But I have no sensation in my nipples, and then that is pretty much that. So making sure that you're doing this twice a day, massaging, getting those massages in, stretching, so putting your arms out and like walking your arms down the wall, walking your arms back out, walking them out to the side, walking them back up. Like doing all of those little tiny movements will significantly help. This one as well, arnica. This is from Turkey. And this is to help with bruising. I had a little bit of bruising around here, and it's like it goes a bit yellow. So I was using the arnica just to help with that bruising and to give myself, just to help with that, with the bruising and the swelling a little bit. This is naproxen. So naproxen is what you will get. It won't say naproxen when you're in Turkey. It'll say something else, but it is naproxen. I got these when I came back from the UK, when I came back from Turkey. I finished my naproxen cycle and still needed pain relief. I still needed to be on as much pain relief as I could. So I went to the GP, told them what I'd had. I'd had a double mastectomy and I needed pain relief. I was already issued pain relief in Turkey and I needed to have the same one, which was naproxen. They didn't refuse me. They said that's absolutely fine. And they gave me a prescription to go and pick up at the pharmacy. But naproxen is here, which you will get a bit like this. And you take it twice a day. So once in the morning and once in the evening, every 12 hours. So I was taking my antibiotics and my pain relief at 8 o'clock in the morning, and then I was taking them at 8 o'clock at night, which really helped because I was sleeping quite well, and I wasn't uncomfortable. And I was also topping myself up every 4 hours with paracetamol, which I said in my other video that my partner worked for an extensive amount of time in the NHS, working in the ICU, doing a lot of stuff around like medicine and medication. So we double checked it and made sure that everything was okay on that side of things. So that was that. I think as well, somebody mentioned about like, how do you get the dressings on without like disturbing anything? And I've just remembered now. So with your dressings, like if you peel it back like this, keep hold of those, you just place it onto your nipples and drag it across. And then it'll stick on there absolutely fine, and it should stay on there for the duration of the day. Also as well, which I've not got with me, is your compression binder. I am just going to put my top back on because it's quite cold. With the compression binder, you will be required to keep your compression binder on for 30 days from your surgery day. With the compression binder, you still need to be making sure that you're doing this. So you'll take the compression binder off. So one thing that I was doing was taking my compression binder off, just stretching out the shoulders, making sure, like, obviously when the surgical tape's still on there, just making sure that everything was okay, making sure that it didn't need anything, like just gently rubbing it down so it will stick in, and then doing this, and then just stretching out the shoulders and then putting the compression binder back on. The compression binder is significantly important to reduce any swelling that's on your chest. And it's also really important for support as well, because in the first instance, when you take your compression binder off, it feels really tingly, it feels really numb, and like your muscle tone is not there. So having that compression binder on really helps for that stability, and also wearing it all the time. So like during the day and also when you're going to bed. Prepare yourself for not being able to lie onto your side. If you've had double incision, that is, lying on your side, like get used to sleeping on your back, because it's quite uncomfortable, mooching around. As you probably saw in my other picture, I used Carnesio tape. So again, my partner is a physio. And Carnesio tape, if you've got quite a lot of swelling, if you know anybody that can help you with Carnesio tape, it really significantly helped with drainage. So having the Carnesio tape pushing the fluid over to your armpits, because you want the fluid to go that way into your armpits, into your lymph nodes, so it drains out. That's when I was saying in my video yesterday that I've been sweating a lot because it's going over into like your lymph nodes of your armpits and your sweat glands and stuff. So that can really help, but don't do it if you're not like trained to do it, or you haven't got somebody that is trained to do it with the Carnesio tape, because you could potentially push the fluid into a different direction, which is not something that you want. I think that's about it, to be honest. Obviously, once the tape comes off, the surgical tape, that's when you will start with this gel. And you'll do it again in the morning and in the evening. And you do this, I think it's for about 13 days, and then you swap over onto the tape. Now, again, like I say, I had a bit of a reaction to the tape. It went like my scars went really, really red, and I kind of had a bit of a rash underneath. Like, from every person that I've spoke to that's used this, they've been absolutely fine. But like I say, I've got eczema, I've got quite sensitive skin, so I haven't been using this tape. But you would use this tape for 3 months, 2 months, maybe. I think. But if you are somebody that doesn't want to use this tape, like I say, I recommend that if you do use this tape, you use it if you're out in the sun, putting sun cream on, putting the tape on, protect your scars as much as possible, or just staying on the gel. Keep topping yourself up with the gel. Keep massaging that into your chest as best as you possibly can. If you are struggling because it's quite like, for me, I get my partner to do it because she will not hold back. But if you're struggling to like massage it in, then maybe see if somebody can give you a helping hand with that. Or if somebody that you can go to somebody who is trained in deep scar tissue massage and see whether they can give you a hand, because it's really important that you do break that scar tissue down, because at the moment for me, like, my movement is quite, it's not restricted, but my pectorals are so tight, and it's obviously because they've pulled everything down and out. But I think that's it, like, from a care perspective. Obviously when you have had surgery, you're only allowed a bottom shower. So you are not allowed to get any of this top bit wet for, I think it's the first 10 days. So everything bottom shower. I was having bottom showers to compensate not having full showers. So having a bottom shower, and also like getting my partner to like lean over and like wash my hair. And also like if you are somebody that shaves your armpits, you might need a bit of a helping hand for somebody to help you with shaving your armpits. But the stretches are also really important. So like I was saying, like out to the side, like walking your arms up the wall, walking your arms up in front of you, walking your arms down, so you can start to feel that stretch, and only do it like to your ability. Like, don't obviously overdo it. And also bringing your hand across. So I can kind of show you now, because it might help. Please excuse my, if you can see them, I've got toothpaste all over my shorts. So like putting your arm out to the side and walking your arm up the wall, get as close to the wall as you can, maybe. Like there, I can start to feel a bit of a stretch. And I started doing this maybe about 4 weeks ago, and just started to like improve. So you hold that for like 10, and then come across your body, like make sure like your hips are like facing this way, like come across your body, do it on both sides, really feel that stretch here, which will help with this movement. And like putting your arms like out to the front and like walking your arms up the wall. For another one for like pectorals is like catching your arm like in the door frame and like leaning into it. Even like doing it now without a door frame, like if I put my arm like that and like lean forward, can feel like there's a real strong like pectoral like stretch there. That is something that's really helped me over the last like couple of weeks. And obviously like going swimming as well has really been helpful, and having keeping on top of massaging and rubbing that in. But I think that's it. Like I say, Amazon, don't be spending ridiculous amounts of money on the wound dressing. Get on Amazon. This was also on Amazon, which I think it was about 15 quid for the bottle. This is actually from Turkey. Obviously I've still got loads of this left because it's the tiniest bit. It's like that, and you just literally blop it onto your nipple. You don't rub it in, you just blop it on and then put the wound dressing on. The arnica, this is from Turkey, and I've used like you can see, like I've hardly used any. I think I've used maybe used that about 3 or 4 times. You can see like obviously that tube's been used quite a lot because I do that twice a day at the minute. And the naproxen, I've stopped taking. I'm not taking any pain relief now for my chest, but you can see there that's only, I got two strips and I've kind of been into them. But yeah, I hope that's helpful. I know that some of you have said like that you wanted to just see what it is that you need to do to keep on top of it. But like as you can see, like my scars are super neat. Like they've gone all the way around. Obviously, you can see then that there's a bit of bruising because of my massage from last night. So you can see that there's a bit of bruising. There's still that redness. There will still be that redness, and there will still be swelling. But overall, like my nipples have completely healed now. You can see that the colors like coming back. I can't feel them, but the colors are coming back, and the muscle, like my pectoral muscles, are developing nicely. Yeah, I hope that's helpful. If you would like me to share anything else that I've missed, please reach out and I can do a little video.